Have you ever experienced severe intense headache that starts at the base of your head and then radiates into the forehead and then goes into the eyes? Then you might have a condition called cervicogenic headache. Let's dive into this video and learn what is cervicogenic headache, what are the symptoms, what are the causes, and how to treat. Cervicogenic headaches are secondary condition, meaning it starts because of the other condition. So usually the issue is in the neck or cervical spine. That's why they are called cervicogenic headaches. These headaches typically originates from the cervical spine or one of the joint in your neck, and it radiates into the forehead or it can go into the eye. This can be because of the malalignment of the joint, injuries, or previous trauma that can trigger this kind of headaches. This is very typical headaches that is dull, throbbing, and very consistent in the intensity. The causes of the headaches varies, but the most common causes are poor posture, muscle spasms, or neck injuries. Conditions like arthritis in the neck, muscle injuries, or even herniated disc can also cause this kind of headache. If you spend a lot of hours sitting in front of computer or driving, you may have a cervical headaches eventually because your poor posture leads to cervicogenic headache. So cervical spine has a 7 vertebrae in the whole column, and it is usually C-shaped, or it's called lordotic cervical curve. Now if you have injury to those joints, or because of the muscles being tight, it can start compressing the nerve root that comes out of the cervical spine, and that can lead to your injuries and then also create muscle spasm due to the nerve pinching, and that nerve supplies the frontal area as well as the back area. Use of the mobile, driving for a long time, using the computer in the slouch posture can lead to muscle spasms, facial numbness, or the numbness in the face, and it can lead to the headaches. And sometimes even lifting the cup of the tea is really hard because of the nerves are getting compressed in the cervical spine, and that can be caused by the herniated disc or the joint getting compressed. Now a lot of time people go to the doctor and it is diagnosed as a migraine, but it could be just cervicogenic headache and not the migraine. And sometime in the worst case, the vagus nerve passes through the neck joints and the muscles, and when those muscles or joints compressing the vagus nerve, which supplies the heart and autonomic system and the breathing muscles too, then people start feeling the compression in the chest, issues with the breathing or racing heart rate or increased blood pressure. Now this can be also because of the cervical issues. So this type of headaches usually starts with the base of the skull. It can also radiate up, also radiate down into the shoulder blade areas, and it can lead to also symptoms of nausea as well as vomiting when it is worse. Now how to diagnose it? Diagnosing cervicogenic headaches involves a lot of examination, especially careful physical examination, as well as if you consult your healthcare professional, they can do X-ray or MRI to rule out tumor, brain injury, or other abnormality in the brain. Once it is confirmed that this is cervicogenic headaches, there are few treatment options. The good news is cervicogenic headaches are treatable and it can go away if the right treatment is done. Medication can also be used in the worst cases, but exercise therapy, physiotherapy, chiropractic care, massage therapy can help the symptoms. And here I'm going to show you 5 different exercises to target cervicogenic headaches and get rid of these headaches for good. Because it is mechanical issue and it can be corrected, then whole muscle and the joint performs better and your symptoms can go under control. So we are going to talk about few exercises that you can do, and here if you want to grab a pen and paper and write it down, or you can follow along and try those stretches and watch this video over and over again to target those specific joints and the muscle to help the cervicogenic headaches. So the first exercise is to target the levator scapulae muscle with eccentric muscle contractions. Now, you might have seen a lot of time that everyone suggesting these stretches. Indeed, it is a good stretch, but we are going to use that muscle and work on eccentric contraction to activate it and also release it so it can decrease the trigger points. How are we going to do it is we're going to put one hand behind and bend your head towards the opposite side and then use the other hand. Now, instead of pulling down, we are going to resist and go backward, and we can hold this contraction for 10 seconds, and we can repeat this exercise 10 times on the both sides. Whenever you have this type of headaches, it is usually one-sided headaches, and when it's one-sided, you can target that side more. So either you can massage that muscle, but activating the muscle by contracting it helps so much. Second exercise is chin tuck with Y, W, L, and V formations. So how do we do that? So first of all, we want to make sure that you do the chin tuck correctly, not really pressing too much backward, but tucking the chin just like this. And then we are going to bring your hands behind and lower a little bit and push backward and do the chin tuck, push backward, chin tuck, push backward. Here you're activating those shoulder blade muscles, same time you're doing chin tuck exercise. This helps to activate the deep muscle in the cervical spine, and this can be done again 10 times. So this you're creating a W first. Then you're bringing your hands a little bit up and then doing chin tucks, and then you're doing this again. So here you carefully watch that, make sure you do the chin tuck properly, and you're doing the Y posture here and pulling backward, squeezing the shoulder blades, and doing this again 10-second hold or 10 repetitions on this Y posture. Then we are going to do T. What is T is you're going to spread out your arm on the side, chin tuck, and then we're going to do T. So this is one of the exercise where you can squeeze the shoulder blades and squeeze and hold. 10 repetition is suggested here. Last motion in this exercise is called L. L here is how you make it is you bring your hands on the side and you create L angle in this area, and then you're going to squeeze the blades, and then we're going to pull back with the chin tuck. Again, 10 repetition for this exercise, and it can be done with combination of other exercise. So here we are doing W, Y, T's, and L with the chin tuck. This is very important exercise to stretch the chest but same time activate the back muscles. Exercise number 3 is a S activation. So here we are going to create S shape in the back. Here bring both of the hand behind, one behind your head and other one behind your hips or the back, and then you're going to bring them back and stretch out and hold. Again, you're going to bring them back and stretch out and hold. This exercise again can be done 10 repetitions, and you can do with the other exercises. Fourth exercise is we're going to use a little towel roll. So here we're going to use a towel that is not too thick, put it behind your head. You're going to lay down, laying facing up, and the towel goes behind your head here. Once the towel is there, you're going to push the towel, and we're going to move hands upward direction and back down again, upward direction and back down again, just like this that I'm showing here. So this is the fourth exercise, can be done 10 repetition, and it's very important that we do every day with the other combination exercises. Fifth exercise is we're going to use the towel or the pillow cover, and we put it behind your neck. Here we need to make sure that we don't do without the towel. We need to do towel and then support the neck and then bring your head backward in a way which moves the certain joints that we don't move on regular basis, because when we use the computer driving, we are using too much slouch posture and we load the specific joints and it keeps irritating same joint. Now we are deloading this joint by doing this exercise. This is also called McKenzie technique, which was researched a lot, and then this is the one of the best exercise for the neck or the disc herniation as well. So these are the 5 exercises we want to target and we can do regular basis. There are also few suggestions of the foods you can take when you have a headaches, and this is also very important if you have a cervicogenic headaches or cervical spondylitis or spondylosis. These are the exercise you can do. Same time you can also do some food, which is I'm going to make another video for. So if you like this video and if you have someone who has a cervicogenic headache and cannot get rid of it, then you can suggest this video, share it, and also subscribe for new videos. Thank you again.